gauge problem, always have done. So I have been spiking temperatures for a year. There's nothing wrong with me. And it's the same with the children. Some of our children are hot babies. They've worn an awful lot of clothing before getting there. So if in doubt, do the temperature recording on the head or on a wrist somewhere else if you're not getting a recording. If you're getting below 36, it's not an accurate recording, so you need to redo that one. So coughs and colds, we are currently sort of just coming out of the end of the croup season, which I'm sure you're all aware of, is the barking cough that children do. It's a very distinctive noise. They can cough quite badly during the day, but they are really sick at night time. So between sort of midnight and 5 o'clock, they can be really very unwell. There's not a lot you can do for croup cough. They normally last 2 or 3 nights, so you've had a very broken sleep for the last 3 nights, and then normally it evolves. If a child's really quite unwell, as in spiking temperatures and not manageable, out of sorts, then do come to A&E and we can give them steroids, which will resolve it. But as you know, with most things, they're viral infections, so antibiotics are not going to help. So we don't give antibiotics for conjunctivitis, tonsillitis, and bronchitis if we can help it, because we need our children to go through these processes so that they can build up their immunity. Sorry, London, near a hospital. Conjunctivitis, you just need to wipe the eye. We try not to give them any antibiotics if we can help it. The ointment is an antibiotic because they will resolve themselves. So coughs and colds, they just need to go through the process if that's okay, and send them home if you're not sure. But I think these children need to be in school almost as much as they need to be at home. It's an absolute 50-50. We've got 3 more days to go, 2 more days to go before the end of term. Just on allergies, I'm sure you're all very aware, allergies are a familial disease. They pass down through a family line. If you've got eczema and asthma in your family, then you've probably got the sort of fault gene coming through. Just because you have an allergen does not mean your child has an allergen, right? A lot of people talk about saying, I'm allergic to penicillin, but when we ask them, they developed a little bit of a rash or had a bit of an upset stomach. So that's what we call an anaphylactoid allergic reaction, so a very minor allergic reaction. The allergens we're very nervous about are the other end of the spectrum, anaphylaxis, and less than 4% of the population are anaphylactically allergic to it. So they have had facial swelling and breathing difficulties post-exposure, and those will be the patients that have EpiPens. EpiPens cost on average £40 a pen, so we're trying to move away from every child having 2 pens and the schools having multiple pens in there. We know during COVID, lockdown 1, that actually the pens last a lot longer than we thought they did. So currently the expiry date says 6 to 8 months, but actually they can go up to over a year after that. So it's better you give the pen than don't give the pen, even if it's an expired pen, because some adrenaline will work, all right? So really haven't got a lot else to say. Was there anything in particular anyone had any questions about, please? Any hands up? I can't see, so.
No hands up at the moment, and no questions so far, Alexandra. I think that must mean that your presentation has been so comprehensive so far.
Any questions, or is everyone happy?
No, everybody is.
I'd just like to say from the nurses that you're all doing an amazing job. I just think getting the kids back into schools made me so happy. These children are really suffering for being away from schools, and thank you so much for all the effort you've all made to turn your schools around to get all our babies back in. Sorry, did Adele have a question? No, sorry, you came off mute, so I thought you answered a question. Anyone else?
No, I don't think so, Alexandra. I think everybody's just pleased to hear what you've had to say so far.
Thank you. Well, if that's okay, then I'm probably going to sign off. I am in the middle of a clinic, so I do need to go. But thank you very much, everyone. Lovely to see you all. Have a super day. Take care. Bye-bye.
Thanks, Alexandra. Thank you so much for your time today. Thank you for giving us that time whilst you're in the middle of working so diligently. We really appreciate it. So that was Alexandra talking to us from Ready. And we now have our next speaker, who is Sadiqa Maljay. So again, forgiving Sadiqa if I pronounced it wrong. Please correct me in a minute when you come on. So Sadiqa is going to be talking to us a bit about testing and how it's being managed, and particularly about dealing with a setting with a lot of SEN children. So Sadiqa, all yours.
Thank you. It's Sadiqa Maljay. You were almost there with my surname.
Sorry, I was slightly wrong.
Gail will be sharing the slides, hopefully. I'm happy to carry on talking while she gets us our slides up. So yeah, I manage an 80-place setting in London. We've been open throughout the lockdown, and we've continued to remain open. What we have found, obviously with that period when lockdown first came in and only key worker provision was provided, we had a lot of parents not sending children to settings. We had children not taking up 2-year places because parents obviously felt it wasn't safe. And came September, when schools and settings were open, you know, sort of for everybody, we sort of started to see lots of children emerging with SEN needs coming through the door. And we found a higher number of children this year. So for me already, I've got 13 children identified as SEN in my setting. And there we are. Okay, you can go on to the second slide. Sorry, Gail. Okay. So we've got a high number of children coming in with SEN. Now, for us as practitioners working in the early years, we kind of, our expectations have changed, because we're trying to identify whether these children are coming in with emerging needs due to their lack of social communication and interaction with other family members and friends, and joining, you know, sort of clubs and, you know, the normal life that, you know, a child would have, or is this because there is clearly something underlying? So that's kind of a bit of a struggle to sort of figure out in the beginning. And then parents not being able to see other children, being able to compare other children, because normally, you know, you sort of have chats, or you see friends' children, kind of similar ages, you get to know children in children's centres. And that not happening, parents are not having that marker to compare whether their child is developmentally at the same level, or at the level they're expected to be. So we're having lots of children coming in with lack of communication, with, you know, very minimal language. So it's about working with these families. That's been putting an extreme pressure on the nurseries. So we're trying to deal with these children that have been cooped up in sort of small flats and houses, because we're living in Hackney, you know, very dense population, very small flats and houses. Children not having that exposure to outdoors. Parents are too scared to take them to the park. So kind of going wild when they come into the setting. So trying to provide a balance of letting them having that energetic play, and then figuring it out whether there is an underlying need. So that's been quite difficult for us, and I believe that's been a generic theme along many nurseries, particularly in the London area. And again, health professionals doing virtual sort of meetings with parents, not seeing them face to face, not seeing the children face to face. You're going by what the parents are saying, and these children are being missed. So coming into setting, I mean, I've had so many children come into setting in September, and they're going to school in September the following year. I have 3 terms to work with these children to identify whether there is something underlying, to get the professionals involved, get the right support for these children before they go into school. So it's really, really put extreme pressure on staff and on settings. Funding is not great because you have the inclusion funding, but you need the parents on board to accept that the child has needs to be able to even process or go through that process of accessing the funding. So yeah, that's really what I wanted to talk about. If anybody else is sharing similar experiences, it would be good to hear what's going on with other settings and whether there's a similar picture around.
Yeah, we've had very similar here at our nursery. I've noticed it's really impacted on a lot of children, and I totally agree with what you're saying. The like communication difficulties. And I do believe it is because they've not had the chance to socialise with others, like you said.
And have you?
So, Sadiqa, can you shed some light on the availability of funding and how you access that funding for those who don't know for SEND children?
Well, I know that as well. Yeah, I'm the SENCO here at my nursery.
Okay, so in Hackney, how it works is we have an inclusion funding where we make an application for the children with needs, but we need parental consent to do that. So if a parent is not on board and not understanding or not knowing the child has needs, it's that conversation, that relationship with the parents, and obviously not having parents coming into the setting, seeing their children firsthand, has been a real challenge for them to understand where the difficulties are. What I've had to do is video record for one particular child that was, that's going to be assessed for social communication difficulties. So her whole term kind of went trying to have that conversations with the parents saying, no, this is not my child. There's something you're doing. It's something about your nursery. So what we had to do eventually is take videos of what we were trying to say, what the child is like in the setting, how the difficulties present themselves when the child is in the setting, and then I had to call the parent in to come and watch the videos with me, and she saw for herself that what we were dealing with. So having to look at innovative ways to get parents to come on board with you to be able to access the support. Also in Hackney, and like other areas, I know in other regions like Leicestershire and Kent, they have SEND funding based on individual children. So with Hackney, you have an inclusion fund. We've currently got 20 hours of SEN support funding to support all my children with SEN that haven't had an EHCP yet. So if I've got 13 children currently on my SEN register, I'm expected to make do with the 20 hours of extra support, where some of the children clearly need one-to-one supervision. So it's put a financial pressure on the settings as well.
Okay, so Catherine's just highlighted the fact that the funding should be available on everybody's local authority website. But Sadiqa, I love the fact that you took video of the children and then engaged with the parents that way. Has anybody else found any difficulties in getting, firstly, parents to accept that there's a problem, and then engaging with parents and making sure that they understand the nature of the problem? As I said, I think Sadiqa's solution of taking some video is quite inspired, but I wondered if anybody else had any other, or thought of any other ways of highlighting this to parents?
Someone's asked a question in chat, sorry. What process can parents follow to get an EHCP for their child? Every local authority has a process where parents can make the request if they feel their child needs an EHCP, and they just fill up an application as a parent. But then the local authority would always contact the setting, and we have to submit the application from the setting as well.
Okay, fine, thank you. And Kira is saying that extra funding is nowhere near enough. I think that would be no surprise to anybody. It's, I think, the state of where we are. Has anybody got any further questions they'd like to ask Sadiqa on this subject? It's such an important subject for all of us, and dealing with this subject matter. Has anybody got anything else they'd like to fire at us. So I think, Tara, you said you were a SENCO. What's your perspective on engaging with parents about such matters and getting them their buy-in? How have you experienced that?
So yeah, you do have some parents that can be kind of in denial, like that's you're describing a totally different child. So I'm also a parent of a SEN child, so I've been on both sides of this, so I do totally understand it. I think some parents just feel like it's their fault if they done something wrong, and I'm also a qualified counsellor, so that's why I get all that as well. So I think, yeah, you have got to really build up a good relationship with parents and use like really like the videos, like you said, Sadiq, is it Sadiqa? Sadiq?
That's correct.
Sadiqa. Yeah, like using videos just so they can see, because sometimes a child will represent differently at home to how they will in the setting. So I know for my daughter, she was the perfect model student in nursery. At home was where the issue was. So my kind of battle was actually getting the nursery staff to see it from my perspective. So I had to do videos so they would see. So yeah, it can work both ways, I think. But
that's really interesting that you've seen it from the other side and you sent videos in from the other side. I think that's fascinating. Has anybody else got any experience of engaging with parents about this matter? I'd be really interested to hear if anybody else has got anything other than videos to get parents aware of what's going on.
Do you know what's difficult is because of the pandemic, we're not having parents coming in. So that natural conversation that you have with parents about what their child's doing, you know, those daily on and off conversations and sort of building that relationship. I feel that COVID has put a barrier on our parent nursery sort of relationship. You know, you see them at the door, but it's all very controlled. You know, you can't stand and talk for more than a certain amount of time. You've got masks on. So it's very controlled. You know, there's no chance, you know, you can't have coffee mornings where they can come in and chit chat. So it's been very, very controlled and very different.
Yes, I understand. And another one of these wonderful things that our friend COVID-19 has to answer for. It's a bit like Alexandra earlier on when she's saying all the new words that we've all learned, like herd immunity and furlough and lockdown, all these new things that we've had to address and learn. I see Catherine's put a load of really good resource links in the chat. So thank you, Catherine, for that. That's really, really kind of you. And she goes on to say that some of the settings that she supported have been having walking conversations in the foyer areas, and they're working well. Catherine, how do you broach that subject matter? Please, if it's easier, take yourself off mute and talk to us. But I'm just intrigued on. I can't imagine that's the most easiest subject to bring up.
Hi.
Hi.
Can you hear me okay?
Yes, perfect. Thank you.
Hi. Yeah, I've worked as an area SENCO in a couple of local authorities, and I work independently now. And I think for me, it comes down a lot to the conversations you have when children start at your setting. So explaining to all parents and carers right at the beginning that it's your job to work with other professionals and that you do sometimes seek advice, and also to introduce your SENCO when children start with you, because unfortunately I think that the phrase SENCO is still creates a lot of fear, that special needs terminology, whereas if you can introduce your SENCO and they see that they're a person and they're a practitioner and they want to help, that just eases some of the anxiety. But it's never easy. I've spoken to hundreds of parents over the years and broached concerns, and it's just very gently. And you can only go at the pace that the parent's ready for. I wish I had a magic wand and could give you an answer that would that would make it all okay, but it completely depends on the parent. But in my experience, it's fear that's at the root of the so-called denial, if you want to call it that. Fear that they lose control, fear that somebody will tell them what has to happen to their child. So a whole load of emotions, and it's having that time to listen and
Yeah.
build that relationship. But I really feel for early year settings, because you're often the first person that's having that conversation with parents, especially at the moment, because health visitor assessments and things aren't going on maybe. So you're the first person broaching that conversation, but don't take it personally. I think it's not anything to do with you, it's just where that parent is at the moment.
Yeah, I think your opening comment about introducing somebody as a person rather than the Senko, it's Senko's got that sort of scary connotation, hasn't it?
Yeah,
And when you realise it's Catherine or Tara or Sadiqa or
Yeah,
whoever it is, but they're
definitely.
humans, and that's it. Everything changes at that point.
Yeah, definitely.
And I can echo that, because I had a parent this year of what I requested, if the area Senko can just come and observe him. And the reaction from the parent, my child's not a guinea pig, my child is not there to be observed and tested. And I was like, this whole notion of what a Senko is, for this parent, it seems alien. So yeah, that's quite helpful, knowing that from the very beginning we introduced the Senko as part of our induction to the family. I think that might just alleviate some of that anxiety and pressure when the Senko comes into the picture.
Well, that's a really good idea. So actually in induction and as part of the introduction to the whole setting, the Senko is part of that introduction process. Is that what you're saying, Sadiqa?
Yeah, that's what well, from what the previous, I can't remember her name, said, sorry.
Catherine.
So yeah, I think that would be really, really good. So as you introduce your staff team to the parents, and as part of your parent handbook or your information sharing with that parent, I think if the Senko was mentioned and identified at that point, and just to sort of ease that, so when the time comes where it comes to SEM plans or the Senko getting involved, at least the parents were already familiar with the person.
Yeah, no, that makes complete sense. Tara's just put on the thread about virtual meetings are helpful. Clearly not as good as face-to-face, but she's right. In the end of the day, it's better than nothing. I completely agree. Just to wrap this subject matter up, but our webinar next month is actually about SEN, and we have two people on it who've got an amazing experience, Joanna Grace and Gina Bale, who are proper industry experts in this sector. So we'll, or in this subject matter. So we look forward to hearing from them next month. Is there any other questions on this? Otherwise, we'll say thank you to Sadiqa. Thank you very much indeed for giving us your time today and for speaking so passionately and eloquently about clearly a subject that's really meaningful to you.
Thank
so
you.
I think we'll move on. Thank you. We'll move on. And I'm delighted to say that we've got Jill Hayhoe joining us. Jill is a nursery consultant from Watermead Day Nursery in sunny Loughborough. And she was on our call as well last month and gave a huge amount of really constructive feedback on several of the subject matters that we were talking about. Jill's going to talk today about vaccinations for staff and staff wellbeing, and particularly supporting those on furlough and those who are shielding. So all yours, Jill. And apologies, she's called Kyla on the screen, but she's not really, she's really Jill.
Thank you. Just to start off, really, the nursery that I work for, we are quite a big nursery, and we have probably on average around about 100 children per day. We're a busy nursery, and our staff work incredibly hard. But here we are, a year on in the life of coronavirus, and just wanted to share some of the things that we've been doing along our journey. And one of the first things is around risk assessment. And our first COVID risk assessment, on the next slide, was completed in March 2020. And now, when I did this, we were on version 15. I'm currently working on version 16. So, we regularly revisit this, and each time the new revised risk assessment is sent out to all of our parents and our staff via our online platform, so that I think that we're keeping things live in the minds of our parents, so that they know that we're not sitting back, we're not becoming complacent. And also, I think it reassures both parents and staff that we are keeping on top of things and you know, as things move on. We've done quite a lot of updating on relevant policies. So all of our health and safety policies and procedures have been reviewed. Our infection control, hygiene, safeguarding, policies and procedures around sickness and illness as well have been revised and shared with staff. And also, of course, we've had to introduce a number of new policies. So new policies for parents dropping off and collecting their children, visitors for essential maintenance, and where we feel it's absolutely essential for people to come in as visitors to the nursery. Settling in sessions, we have new policies and procedures on that. Hand washing, obviously. Staff uniform, you know, staff not going home in uniform, not coming to work in uniform, how we clean uniforms, etc. Staff wearing masks when they are moving around the nursery. How we use the staff room. So we've opened up a separate area of the nursery as an overflow area. So we're limiting the number of staff who are in the staff room at any one time, you know, with social distancing. And also we've introduced a new procedure where we're fogging various rooms in the nursery at the end of each day. And again, you know, I think it is about reassuring people and about building people's confidence in what we're doing, and that we are keeping abreast of things and we are managing things effectively. The next slide is focusing around staff wellness. And obviously we employ 56 staff. And each one is an individual, and we're aware of the various impacts that COVID has had on individual staff. And we have had a number of staff who have been in the clinically vulnerable section. And some of our staff have not yet returned to work at all. For those staff, we contact them weekly, or we ask them to contact us weekly. They're included in all the information that goes out on our online platform to keep them in touch with what's happening in the nursery. We've had quite a number of staff who have struggled with their mental health, with their well-being, and we have adapted patterns of work for individual staff at different times. So it's not been a blanket decision for all and any staff. We've looked at it very much on an individual basis. We spend quite a lot of time with our staff, walking around, chatting to them, not just about work, but also about how they are. And so we've actually changed patterns of work, and we've reduced patterns of work for some staff. Some staff, that's been quite short term. Other staff, it's been longer term, and it's still ongoing. Where staff have been away from work or changed their pattern of work, when they feel ready to return to their regular work pattern, we have put in place phased return to work opportunities. When they're ready, feel they're ready to return to work, we've kind of built up their shift patterns gradually, and we've taken time to discuss with them what concerns they have about returning to work, and also reiterating some of the protective measures that we have put in place generally. But if there are specific protective measures that they would like to have put in place as well, and how we can accommodate that. We've done a lot on supporting our staff, their mental health and well-being. So we've done mindfulness challenges. We have a well-being wall in the staff room, and on the currently on the well-being wall is if you could holiday anywhere in the world, where would you go? What is your favorite holiday destination? Kind of giving people something positive to focus on. We also have a free fruit bowl for staff to support, you know, sort of like healthy eating. We've done aromatherapy online experiences. We've offered festive gym passes and festive treats. We've provided information on mental health support and the top 10 mental health apps. Last week, we were doing hydration motivation. So all the staff got, you know, sort of a free bottle of water with a positive hydration motivation quote on. We run Healthy Heroes competitions and staff receive rewards for those things. So as well as running the nursery, maintaining standards, quality, keeping everybody safe, we also are investing quite a lot in keeping staff well and letting staff know that we're here for them and that, you know, staff have different needs at different times. The next slide is with regards vaccination and lateral flow testing. And I don't know, perhaps oversharing here, but back in February, and I'm sure you may be aware of it, information was being widely circulated that health and social care, including early years practitioners, could book for vaccinations. Obviously, this is something that we became aware of, and also our staff became aware of. And rightly or wrongly, a lot of staff did book vaccinations. And currently, 83% of our staff have had their first vaccination, and they have a date for their second vaccination, even though it's probably only about 5% of our staff that fall within the categories for accessing vaccinations. So we did kind of take advantage of that. Seemed you know, an opportunity that came our way, and staff did kind of jump on that bandwagon. Then at the beginning of March, so most recently, we've been contacted by our county council with regards the possibility of early vaccinations for staff working with clinically extremely vulnerable children and clinically vulnerable children. So we have checked with the local authority, because we thought we've got probably 5 children who fell into these categories. But after further conversations, we actually have 3. And so staff who work directly with those children, they are in the process of currently accessing vaccinations. As a setting, we have introduced a vaccination policy. We can't force staff to have vaccinations, but what we've tried to do is to provide staff with a lot of factual information on the vaccination process. And as I say, you know, it's been received very positively. But then I think it was just yesterday, or it might have been earlier this week, we have received from the DFE guidance on staff vaccinations. And also we introduced a lateral flow test guidance sheet. And again, just recently this week, we have had guidance from the DFE on lateral flow tests for staff. But so this week, oh, excuse me, all of our staff have started to take lateral flow tests twice a week. They're doing it from home. Most of our staff have accessed the test packs themselves, although we do have a supply at work for anybody who needs them. Apologies. I have done a test today. I am negative. It is a cough and a cold that I have.
Have a drink of water.
Thank you. So we are, you know, sort of like positively encouraging our staff to take up the vaccination if they're eligible, as and when it becomes available to them. And as I say, we are doing the lateral flow test twice a week at the moment, and staff are more than happy to actually have the opportunity of doing the lateral flow tests. So yeah, I think that we've kind of taken staff on the journey with us. We've kept them informed at all times. And I think that has kind of inspired confidence from the staff. And that's why, you know, we've kind of been able to keep things moving. And my final slide is just one on where we've been accessing support from. So, you know, we've accessed guidance, support, information from everywhere that we possibly can, where we feel it's a trustworthy source. And, you know, sort of like, obviously the list that I put up there, you know, sort of like, because it's not just all national stuff that we've accessed. We've also looked for local guidance, not just from the county councils, but also from our borough council as well. So, yeah, I mean, that's all been helpful in informing and keeping us current with what's happening. But obviously that list is by no means exhaustive, and I'm sure you've all got your own lists. And that's it. So I hope you found it useful, helpful, and I've put my details on the slide. I'm assuming the slides will possibly be shared. And, you know, if anybody wants to contact me or the nursery after this session, you know, more than happy to speak to people and to share our journey with you. Thank you very much.
Jill, that was just brilliant and completely inspirational. Thank you so much for sharing all of your ideas with us. I have to say, I've written so many notes as I've been listening to you. The thing I think perhaps surprised me more than anything else is the extent of which you have sort of changed systems and processes. You know, you talked about all of the additional things like healthy heroes and wellness walks, and I thought they were incredible. But clearly, the cost to the business has been quite exceptional. Have you? I appreciate it's not about cost, but have you had any sort of concept of what the impact of all of that may have been? You know, clearly priority is staff and children, but I wondered if you had any sense of how much that's cost you. Firstly, and secondly, I'm assuming there's no way to recoup that, but I'd love to hear your view on it.
No. We generally, as a setting, offer a number of incentives anyway. So, you know, things like, you know, our staff get a £50 birthday bonus. Our staff get, we do employee of the month. And because we're a big setting, we have 2 employees. They get a £50 bonus. We do regular kind of social events that the company director funds at no cost to staff. So we've kind of, where we've spent money this year, is where we've saved money on some of the social events that we would normally have put on for staff. So we have a summer star awards, and you know, everybody gets to go to a local venue. There's a meal, there's free drinks, there's the disco, there's a photo booth, you know, all of this sort of thing. So we've actually saved money from that. So the Christmas extravaganza, that didn't happen. So where we've saved money on the bigger events that we would normally put on for staff, in actual fact, we've probably saved money overall, because, you know, some of the things are freebies that we've been able to source. It's not always a tangible item that staff get.
Yeah.
Sometimes it's just a shout out. And I think they just appreciate things, because one of the things that we are aware of is to keep changing it. Because, you know, if you carry on with the same thing week after week, staff kind of, I don't know, don't feel the benefit of it. Whereas if, you know, for a couple of weeks we're doing one thing and then we change it to another, it refreshes staff and kind of reinvigorates them. So we are mindful not to let things become tired and kind of naturally just die. You've got to keep things live.
Yes, I agree. As soon as something becomes regular, it becomes expected, doesn't it?
Yes.
And if it becomes expected, then it's no longer a real benefit. So the other thing you mentioned, which I was fascinated about, if you recall on the coffee meeting, we talked about vaccination, and there are a lot of people who expressed a lot of nervousness around that, and nervousness about getting their staff vaccinated. And yet you said you had 83% of your staff vaccinated, and I think you said 54 staff, so that's 9 who are not yet vaccinated.
Yeah.
That's pretty impressive, Jill. I mean, that's a staggering high number. I doubt many other settings have got that sort of number in play. You implied you put that down to applying early, but perhaps more importantly about providing facts and figures and real information, an education program for your staff. Can you put a bit more meat on the bones for us about that? What did that education program consist of?
It was mainly information from Public Health England and from gov.uk. And a particularly useful document was the COVID-19 response for spring 2021. That was because it's quite a meaty document. And we made it fully available for staff, for those who want to delve into all the detail. But then we signposted particular paragraphs or sections of it that we felt were kind of key in helping people to make informed choices. Also, there was working safely during the coronavirus outbreak. That's a public health document. Yeah, I don't know, you know, we've sort of like, we have, because we're charting our coronavirus journey, the personal journey of the nursery. But equally, we've got all of the handouts, the guidelines, the updates and everything in, I think we're on our 3rd Lever Arch folder. You know, it's massive, it's been massive. But we feel that, you know, it's important to continue to support staff. Some of our staff have worked tirelessly throughout the entire pandemic. So, you know, they deserve to have all the information that we can make available to them.
Yeah, I'm really impressed with that. And I love this education journey. If you recall at the coffee meeting, there was a number of people who were concerned that staff were being influenced by some of the stuff on Facebook and the anti-vaccine campaigns on Facebook.
Yeah.
And I'm really, really impressed with how you've taken that education piece and got those sorts of results. 83% is just staggeringly good. So
Yeah.
brilliant. Okay, last question from me, and there's some other questions I need to pick up on, but your talk was so inspirational. Wellness walks. You talked about wellness walks. Talk to me about that. I know what a walk is and I know what a wellness is, but tell me how that works.
We've always done sort of like shout outs for staff in terms of inspirational activities, experiences that they've provided for the children, special events. But we now make sure that we walk the nursery floors, we go in the rooms, we spend time with the staff talking about what they're doing at the moment. You know, we've got some staff who are doing sponsored runs. We've got people that are raising money for different charities. We've got staff who, throughout all of this, are studying, you know, their university courses and are achieving exceptional grades. So it's more personal than professional, so that we're taking an interest, but also we're including our children in some of these. So last week, was it last week, the week before, we did, it was Intergenerational Week. So our children took daffodils, bunches of daffodils, to all our local residents, because we live sort of on the outskirts of Loughborough itself, but we do have domestic properties around us. And because we couldn't go up to the local nursing home where we would generally go, we decided that we'd reach out to our friends and neighbours in the locality. So, you know, that was an extension of the wellness walk, that our children were hopefully spreading some wellness. And also it was an intergenerational experience for them as well.
That's brilliant. Okay, good. Thank you so much for that. So, Ngiro, and I hope I pronounced your name right, is saying that no one's been vaccinated in her setting at all. She thinks it's an age issue or a youngster age issue. But Jill, you said that you applied for something because you saw some sort of something on a website. Do you know what that website was?
Oh, well, no. It was from an unreliable social media source, I'm afraid. And that's why I say that, you know, perhaps I'm sharing too much here, because it transpires that perhaps we were not eligible. But we saw an opportunity and we thought, oh my goodness, well, if we can get vaccinated, and literally we were phoning and we were on the, you know, sort of the booking the vaccinations online. And literally, I mean, I wasn't in work on the Friday and I saw this message on our online platform. So I followed the link and I was vaccinated the next day.
Really?
Yes. And so were most of the staff. They were vaccinated literally within days. But as I say, it does transpire that maybe we weren't eligible. But we saw an opportunity and took it. I don't, you know.
I think you saw an opportunity and grabbed it with both hands, Jill, and good on you.
Yeah, me too.
Yeah.
All right, really, really good. So, has anybody got any specific questions around this? We do have a wellbeing, a mental health course, which we'll send out when we follow up after this event, and it'll go in the email follow up. But are any specific questions? Anybody want to ask anything? Oh, sorry, Nguru, you asked for Jill just to repeat the list of the extracurricular support things that she would produce.
Well, I don't know if everybody wants it, but I'm going to contact Jill later.
Yeah.
After the session, I'll contact you if you don't mind.
Yeah, that will be absolutely fine.
Thank you very much. I think it's a brilliant talk and you do a lot of good things in your setting.
Thank you. Thank you.
Good. Aisha has asked if you get a certificate for joining this webinar. Unfortunately, you don't, but what you do get is a load of great courses and discounts for courses, particularly, as I said, around wellbeing, mental health, and there are some other CPD courses, and there are discount coupons for all of those. So I hope that will help.
Sorry, can I just ask Jill something quickly?
Please.
Coming on to the employee of the month, we had that up until about 5 years ago, and I found that there was a lot of bickering and sort of things going on among the staff when they didn't get the employee of the month and the ones that did. And then we kind of completely stopped that because of that. But I'm just wondering if anything similar is happening in your setting and how you manage that, because, you know, obviously if it was having a negative impact on the morale of staff, we decided that this wasn't worth doing at the time.
We do manage the system somewhat, because there are always star staff who you could give an award to every single month, but there are other ways of giving people shout outs and actually recognizing perhaps the quieter staff, the staff who kind of get on with things and, you know, maybe nurture the children, rather than the noisy staff who are big and bold and, you know, doing lots of exciting things. So we do track who has had the award each month, and we do make sure that that's not repeated. And for staff who don't get that, we try to balance that up in other ways, so that at some point, at some time, all staff get some recognition. And as I say, normally we have Star Awards in the summer, and at Star Awards, every single member of staff gets a Star Award. And then we have special awards that are voted for by parents and by staff themselves. So it does need to be quite carefully managed in order not to lose staff's enthusiasm and commitment.
Thank you for that.
That makes sense. Okay, a couple of other points to come in. Julie Ringrose is saying 5 out of 8 of her staff have been vaccinated. That's because they're clinically vulnerable. And Giro, yes, the webinar is recorded. So all the information that Jill went through will be available to you. And of course, we'll send that out after the event. Excuse me, are there any more questions, ladies and gents? Any more questions for Jill or any other generic questions? Otherwise, we will start to wrap up this session. I mentioned earlier we have another session in April, which is again talking about SEN, and specifically we've got 2 experts on that who will be talking more and more, giving everybody a bit more information. But are there any more questions for today? In that case, I'm going to thank our speakers for today. So that was Alexandra from Relief, and then we had Sadika, who was absolutely brilliant, from Little Gems, and obviously the brilliant Jill, and who's so inspirational with her talk from Watermead Day Nursery. It really, really was inspirational what you were telling us, Jill. And so thank you to everybody. We'll wrap up then today. Thank you so much to everybody for joining. Of course, we'll send out the recording. We'll send out the mental health workbook that we've got, and we'll also be sending out some CPD courses with some discount codes. Thank you again for joining. Speak to you all next time. Thanks again. Take care. Bye-bye.